Hi friends, Dr. Shalini here, fertility specialist from Lucknow. So today we will talk about blocked fallopian tubes, why they are blocked and what is the treatment. So whenever patient comes to us that she's trying to conceive and she's unable to, tubal test is one of the most important test. सबसे important test है जो हम करवाते हैं. Why? Because it is a tube through which an egg travels from ovary into the uterus. So you can say tube is a road or it is path for egg to reach the uterus. And most important, it is the tube where fertilization of egg and sperms occur. So it is very important that your tube is good and it is healthy and it is functional. It is open because it is a pathway for egg to travel. So for the detection of the open tubes and the functional tube, we usually offer two tests, and one of them is HSG, hysterosonosalpingography, which is an X-ray test. We push a dye and take an X-ray. And another one is ultrasonography, SSG, sonosalpingography, in which we put a saline and do an ultrasound to check whether the tubes are open or not. So HSG, as many of you who have undergone this test might know that it is a bit of painful test. So what happens due to pain or a fear a female which is she carries during the procedure, due to fear the uterus it suddenly contracts, and when uterus contracts the opening of tubes जो कि यूट्रस के पास में है वो ओपनिंग सडनली वो भी स्पाज्म में जाती है, वो भी कॉन्ट्रैक्ट कर जाती है. तो ड्यूरिंग द HSG प्रोसीजर both of the openings they contract and एक false report आ जाती है that their tubes are blocked and bilateral tubes are blocked, and many times even one-sided tubes भी होता है कि one-sided tubes had undergone spasm and it is a block. So this is one of the major drawback of HSG. Major confirmatory test is doing laparoscopy. So while laparoscopy, we do a dye test. If your tube is actually blocked, it can be blocked at any end. At the end where it is opening on the ovaries, or at the end where वो uterus के अंदर open कर रहा है, या फिर in any part of the tube in the middle. So what happens if it is blocked in center or any part of the tube? It is very difficult to cannulate, and most important cause of these blocks are infections. And in India, the primary cause of infection can be normal genital infection या फिर tubercular infection. And this tubercular infection, if it is there in tube, it completely, maximum time it destroys a tube a lot. So when it is blocked at the cornual end, if it is not due to spasm, we can open these kinds of tubes, these kind of blocks we can open, and it is done by hysteroscopy procedure where we try to cannulate using a guide wire. We pass that guide wire through the opening and try to open these cornual block. If they are not too hard and they are not fibrosed completely due to long or prolonged infection, बहुत पुराना infection अगर हो जाता है, then these openings they are completely fibrosed हो जाती हैं and it becomes difficult. And the fimbrial end जहाँ पे वो tube ovaries पे open कर रहा है, अगर fimbrial end में if there are flimsy block, we can try to open them as well. Many times अगर बहुत flimsy blocks होते हैं, they can be treated by medicines as well. So this is how we can detect whether it is and confirm. So this is how we can detect कि tubal block है, tube opening है या नहीं है, and how we can try to open if there is blockage or not. So we can try to open it as well. But you should know that simply opened tube is not important. Tubes का functional होना, healthy होना is also very important. Many times what happens, tubes have hydrosalpinx. So that in these cases that infective fluid can prevent pregnancy, prevent fertilization, and it can prevent traveling of egg into the uterus, and it can cause ectopic pregnancy. Similarly, tubes में cilia होते हैं, which act like a brush, you can say, and they tend to push the egg from the tubes into the uterus. तो अगर ये cilia non-functional है या infected है, तो वो proper functioning नहीं करेंगे, and because of this, वो egg वो push या travel नहीं कर पाएगा and it also stays inside the tube and it causes ectopic pregnancy. So what is important? The functional tube is very important. It should not be infective, there should not be hydrosalping, and cilia का proper function बहुत important है. So we can treat all of these at a time. Thank you.